Hello and welcome to this Eating and Feeding Difficulties Parent Workshop. My name is James and I'm a clinical psychologist based at the Children and Young People's Eating Disorders team in Northamptonshire. This video focuses on providing parents and carers with a range of different strategies to support children with restrictive diets. The strategies are targeted to support children between the ages of 5 to 12 years old. However, some may be applicable for older children too. Here is a list of the strategies we'll be covering in this video. It's important to note not all of these will be appropriate for your child and their needs. Please consider your child's age and their level of motivation for change. It may also be worth considering what you understand about your child's eating and feeding difficulties and whether there are any particular factors that explain their restrictive diets. For example, some young children may avoid eating certain foods or food groups due to particular sensory sensitivities. For these young people, sensory desensitization would be an appropriate strategy to use. Older children may struggle to engage in types of messy play. This doesn't mean you cannot use the strategy, but you may need to adapt it in line with your child's age. For more information on understanding feeding and eating difficulties, please refer to our Eating and Feeding Difficulties video. When thinking about implementing these strategies, it may be important to hold a couple of things in mind. Firstly, just identify one or two strategies that you think would work best for your young person and start there. We know that change and progress can be slow for people with types of eating and feeding difficulties, so ensure you allow plenty of time to give the strategy a go and try not to be too discouraged if you do not see any change in the short term. We would recommend trying out strategies for at least 6 months before choosing to try a different one. Another important factor to consider is consistency. We know that many young people experiencing feeding and eating difficulties also experience anxiety and worry around meal times. Therefore, the more consistent you can implement the strategies, the less anxiety-provoking they will be for your young person, the more that you try them out. This also means there is a higher chance of success because the young person is more able to focus on the task as they become more familiar with it. The purpose of food or messy play is exposure. It is a way of supporting a child to increase their familiarity and tolerance of different foods and sensory experiences. It's important to note that when we talk about food play in the first instance, this doesn't necessarily need to be with actual food. If jumping straight in with actual food is too overwhelming, then your child may find it more helpful to begin to familiarise themselves with different food using pictures or videos. You could also consider using plastic play food. Food play is a form of messy play, but it does not mean it has to be messy. Some children are extremely aversive to food outside of their accepted safe foods. Therefore, it might be better to start with a more simplified version of exposure. Some examples of this could be writing a shopping list and finding those foods in the supermarket, playing hide and seek with packaged food items, playing with plastic foods, or drawing pictures of foods. It's really about getting creative and collaboratively identifying ways to expose your child to different types of food. The sensory approach is meant to be fun, to help your child develop positive relationships with food. So it's important that these games, that there is no pressure to taste the food. If your child really hates picking up the food, start with non-food games or play foods that they already like. You can then gradually build up to introducing new foods using other strategies such as sensory chaining, which we will come on to talk about later. Exposure also doesn't initially have to be in the context of food. You could try introducing sensory play in the bath. Children are used to feeling the water and bath products on their skin, so you could try and use bath toys to include hard textures, foamy textures, slippery textures and spongy textures. You could also get them to wash their feet, hands and tummies themselves. All of these are great ways to building up tolerance of sensory sensitivities. Not everyone will take to sensory play immediately, so it's fine to start slow. The important thing as a parent is to role model for your child. This can include talking about how it feels and showing the child what they could get involved in. If your child finds it too difficult or overwhelming, there are a number of things you could try. Firstly, your child could direct your play, instructing you as the parent on what they want you to do or create. If touching the items with their fingers is too much for your child, using a tool can help them bridge this gap. This can be anything from a spoon, a sponge, a paintbrush, a piece of cloth, or even using gloves. Other important things to hold in mind for food play is to keep it separate from meal times. Food plays should only last between 10 and 20 minutes. There is no need to end food play with a finished product. Always let your child lead the play. Food play should be messy, so try using a laminate floor or plastic sheet. Gradually extend what your child will accept. Move from drier to wetter or stickier textures. Or move from getting the food on their hands to then dabbing it on their face and their lips. And you can also role model this as a parent. Sensory desensitization is a therapeutic technique aimed at reducing the sensitivity of particular sensory experiences so that they become less overwhelming. It involves gradually exposing your child to stimuli that they feel uncomfortable with. It's important to start with a substance that your child is familiar with and likes the feel of. Then gradually introduce textures or stimuli that are less familiar or tolerated. Using a food diary can help identify safe textures. You then gradually move from one texture to another. For example, start with Weetabix and then gradually add in milk or water. This gradually changes the consistency and the texture. Another example is illustrated on the slide. For example, you start with flour, then add cocoa powder or sugar, and then integrate rice or couscous. The key is to start with a familiar texture. These activities can get messy, so as previously mentioned, using a tablecloth or doing it outside may be worth considering. Another important thing to mention is that your child should be reassured there is no expectation of eating anything. The strategy is all about exposure to different textures and experiences. It's also important to complete these activities outside of mealtimes to make them less anxiety-provoking and more of a fun activity to do together. Another example could be water play. You can integrate in milk or coloured water or squash. You can use dry pasta or couscous for mixed textures, things that won't go mushy instantly. Then you could walk into adding in corn flour to thicken the texture, or you use things that could go mushy such as cereal. Gradually work towards getting thicker or wetter textures. The important thing is to get involved, make it fun, turn it into a game, and get messy yourself. Try not to show any disgust or anxiety around being dirty or having unusual textures on your hand or clothes. This can be hard, but sometimes when a child who is already sensitive to messy play can become more hypervigilant and anxious and will pick up on your behaviours. If your child still needs some toys or tools during sensory play, that's absolutely fine. Just remember, you may have to repeat some activities until they feel ready and comfortable to go on to the next step. Systematic desensitization is a behavioural technique used to overcome anxiety-provoking situations and objects. In the context of eating and feeding difficulties, it involves gradually exposing your child to unfamiliar or feared foods. It aims to break the cycle of avoidance and support children and young people to learn that they can tolerate sensory experiences and reduce associated anxiety. Systematic desensitization is a useful strategy for children over the age of 3 and 4 years. The goal is to end the desensitization in a taste trial. For instance, your child chewing and swallowing a new food. Therefore, it is very important to have your child's understanding, their consent, and motivation for this intervention. There are many steps involved, and it can sometimes take quite a while to move in between each step. It's important to only identify 1 or 2 foods to work on at a time. And it's natural for children to feel the need to be in control of what goes into their bodies. If your child is old enough, try and get them to participate in identifying the foods. So what does it involve? Identify a food that your child has agreed to try. Then schedule in a time that is the least stressful time for your child. So you may like to think about whether it's worth doing this before or after school, or leave it till the weekends. Provide a bin for spitting out the food if necessary, or even a tissue. You can practice relaxation immediately before a taste trial, or even afterwards as well. And there will be ideas for other relaxation strategies in another video. Identify a small amount of the food, such as a 1 centimetre square. Support your child to taste the food, and they can spit it out if they want to. Reward your child immediately after they've tasted the food. You can provide a drink as well, and may even try and get your child to rate the food on a scale, such as 0 to 10, 10 being a food that they really like. It's important to try and repeat this food trial as many times as you can. The more consistent that you do this and the more times you try it, the more likely your child is to accept this food as part of their safe foods. Remember, this can take quite a few attempts and can take a while to be incorporated into their diet. Here is an example of a table you could use to record the taste trials. Using reward charts or sticker charts may also be a useful way of reinforcing behaviour change, though this may not be suitable for all children. So it's important to take into consideration what you know about your child and whether you think this would be a useful strategy or not. You know your child best. It can also be helpful to stay away from rewarding with food items, as this can reinforce the idea there are desirable foods and less desirable foods. Here is another chart that can be useful to help your child visualise where they are and help monitor their progress. I'll now talk through an example of what systematic desensitisation taste trials could include. The first stage is about the child just poking the food. This could be with their hand, or it could be using a tool or utensil, such as a spoon or a fork. The second stage, your child could then pick up the food and notice the feeling in their hands and also the different texture. Stage 3, your child could then smell the food. Stage 4, the child could then place the food to their lips. Stage 5, the child could then lick the food. Stage 6, the child could then place the new food in their mouth, but then also spit the food out, so make sure there's a tissue or bin provided. Stage 7, the child could then chew it a little bit and then also still spit it out. And stage 8, the child could take a bite from the food and swallow it. Each stage can take weeks, if not months. It's important to ensure your child is completely comfortable with their current stage before moving on to the next. To support knowing when to move on to the next stage, it can be helpful to support your child to identify their level of anxiety. For example, your child could rate anxiety before and then after tasting the food. For example, your child may rate their anxiety as 5 before the trial and then 3 after doing it. You could then consider moving on to the next stage. A rating of anxiety does not need to be at 0 before moving on to the next stage. There just needs to be a reduction. It's important to hold in mind your child is experiencing extreme disgust or fear and will need time to allow them to process and become comfortable with these new experiences. It can be also helpful to be open and honest with your child in an age-appropriate way around the reasons why you're doing this with them and why are they getting involved in these activities. Food chaining is a strategy that focuses on introducing new foods by building off existing safe foods. The aim is to systematically expand food variety in line with the child's preferences. For example, in the context of texture, taste, temperature, colour, or the appearance of foods. Targeted foods are carefully identified and mapped based on those currently accepted in the context of their flavour, texture, and visual properties. The aim is to gradually link from one food to another by changing different aspects of the food. It's really important to involve your child in this process and not to do this in secret, as that can lead to the child rejecting accepted safe foods. If you are making changes to your child's safe foods, make them aware. Try telling them that you've made a small change and put it on a different or special plate, or use specific cutlery, or doing it at a specific time of day away from meal times. We want them to anticipate that they will taste, smell and look different, but that is okay. And if they want to spit it out or simply lick it, that's okay too. This slide illustrates the way to map from one food to another. It's important to consider when to incorporate food chaining into your child's daily routine. Things you may want to consider is whether to try the food before or after meals. It can be helpful to think about asking your child when they'd like to do this, and hold in mind the idea of control and reducing pressure. This is key to gradual acceptance. Remember the idea around division of responsibility. Your responsibility is to offer food opportunities and provide the food. It's your child's responsibility to make those choices around what they eat and how much they eat. Here are a few examples of what food chaining looks like. One of the examples illustrates how you can go from shop-bought chicken nuggets all the way to lightly breaded baked cod. It shows you how you can change just one aspect of the food at each step to go from one food to another. As I said, it's really important to have your child aware of the changes that you're making and to have this separate to maybe other meals that they have. If food chaining proves difficult, then consider some of these other strategies. It may be useful to use transitional foods. This is where you use an existing safe food in between the bites of new food to encourage your child to eat the new food whilst also masking the aftertaste of the new food. You can also use their favourite drink. The reason we try and add in bites of safe foods is because if you have predominantly eaten the same selective food for a long time, any change in flavour or use of different taste buds, i.e. sweet and salty, is likely to be experienced more intensely. An example of this could be eating a safe food such as plain Walker's crisps and then trying to add in salt and vinegar crisps. So the idea would be to eat alternating plain crisps and salt and vinegar crisps to help accept this new flavour. Another strategy is to use flavour masking. This is where you identify flavours accepted by your child and incorporate these into new foods. Flavour masking increases the approval of new foods because it allows the child to experience a similar taste sensation. For example, you could use preferred seasonings or sauces when trying new foods. Other things to consider when food chaining is it's important not to move on to a new food until your child is comfortable with the current food they are trying. So try not to jump from one food to another. Really give them a go. Try and give them as much choice as possible. Some chains may need to be very simple to start off with. i.e. just different types of salt and vinegar crisps. This is still progress, especially if your child only accepts particular brands of crisps. Some parents worry that food chaining may just introduce more unhealthy foods. However, there are several advantages of food chaining, even when it means expanding your child's existing repertoire. Also, remember, there's no such thing as bad food. All food is good food. It's also important to know, if your child is able to accept another range of the same type of food but different brand, that just gives you more choice, and sometimes will avoid that specific sensory satiety and dropping of foods. It also gives you more choices if you're away from home or you're unable to get your normal brand of food. Thank you for watching this video. We hope that you find the strategies and interventions discussed in this video helpful. You can find more strategies and relaxation techniques in another video on iDiscover.